Good afternoon. Welcome and thank you for joining me this afternoon. I'm Scott Harris. I'm State Health Officer with the Alabama Department of Public Health. We appreciate you coming to listen to this news conference today. We wanted to take this time today just to update the people of Alabama on the status of the coronavirus or COVID-19 infections that have been reported around the country and around the world. At this time, we still have not identified cases of coronavirus infection in our state. I wanted to make sure to state that explicitly today. We're well aware that there are rumors around on social media and other places, phone calls and many others who claim to have knowledge of those infections. We do not have any confirmed cases of COVID-19 or coronavirus infection in our state. I have checked just again in the last 15 minutes. There are no positive tests from public health, and there are no positive tests from the private laboratories that are providing testing services in our state and that are required to report their results to public health. We certainly understand that people have a lot of anxiety and fear about this. It's certainly frightening to see what's going on all over the country and all throughout the world. And so I think many times anxiety can cause people to believe these rumors and to spread these rumors. So we just wanted to assure you that we will absolutely let the people of Alabama know as soon as we find out about a case. We have a process in place to make sure that the public is protected and that the public finds out exactly what information that we have while still respecting the privacy of the person who may be infected. Our plan and procedure is to immediately issue to the public the county of residence of someone who we find out is infected, and we will do that as soon as we can possibly do that once we know about a case. We want to remind you that if you're someone who is worried about being infected yourself and wish to seek help, we would ask you first to pick up the phone, first call your own healthcare provider and talk to your healthcare provider about whether you need to be tested. Your healthcare provider can ask you a few simple questions, can help determine whether you meet the suspicion that he or she would have to have you tested. And then if you need to be tested, your provider can contact us at the Alabama Department of Public Health, and we will arrange that testing for you. We are not doing testing at county health departments. We would ask the public not to show up at county health departments because we do not have the ability to screen you and test you in those facilities. All tests are actually done at the state lab here in Montgomery by public health. However, you can be screened in many locations, and screening is a lot like receiving a flu test where you have a swab in your nose or a swab in your mouth. That can be done at a lot of locations around the state, and public health will be happy to arrange that and then transport your specimen here to Montgomery for testing. We know that there are a lot of events happening today, and I'm sure you've heard many things about sporting events being canceled and entertainment events being canceled. I wanted to make a recommendation to you today as our state health officer that we think it would be wise for people to avoid mass gatherings of 500 or more people. A similar recommendation today came out from the health officer in Jefferson County, and I agree with that recommendation and would like to make that to the rest of the state. We have also been in conversation today with the Mobile County Health Department as well. As you may be aware, we have those two metro health departments as well as the state health department in Alabama, and we all want to make sure we're on the same page about that. The number 500 is, by definition, a little bit arbitrary, and I would say that the number of people in a gathering is probably less important than the actual social distancing that goes on. These are the same things that we've been talking about for several weeks now. We would encourage people to use good hygiene, to wash their hands, to avoid touching their face, to cover their cough. And when you're in crowds of people, try to stay at least 6 feet apart. There's something about the coronavirus that 6 feet seems to be an important number and makes it easier to transmit if you're within that distance. So we would encourage people to avoid being within 6 feet if you're out in a crowd, if that's something that's feasible to do. Our recommendations to avoid public gatherings are not recommendations for workplaces. We are not encouraging workplaces to cancel work. I think it's always prudent to consider whether it's possible for employees to work at home, whether you have HR policies in place in case there should be a reason to have people work from home. But we are not intending for this recommendation today to apply to workplaces. Similarly, we are not recommending that schools be canceled, daycares or institutions of higher education or colleges and universities. This is not a recommendation to cancel those schools or those programs. We've been in conversation very closely with the state superintendent, Dr. Mackey, with all of our colleges and universities, and there are many different factors to consider there. The recommendation that we're making today simply applies to those what we would call mass gatherings, large mass gatherings, 500 or more people. And I think we were thinking of things like sporting events or festivals or other types of entertainment that would have large numbers of people. There are some people, as you know, who are particularly susceptible to infection with coronavirus and particularly likely to have bad cases. That would be people who are elderly, people that have chronic health problems. And for those people, I would say it's always very prudent to be careful about being in crowds and being around a place where you might contract illness. And that really applies in flu season any year, every year, but particularly at this time as well. So we don't have any other specific guidelines. Again, this is not a health order that we're requiring people to cancel these. This is certainly a case-by-case basis that different organizations and jurisdictions would need to make for yourself. But as state health officer, I believe it's in the best interest of the public health in our state that people consider avoiding these mass gatherings and trying to limit the disease transmission as much as possible. Finally, I'll just reiterate what I said earlier. We do not have any confirmed cases of COVID-19 in our state. We have done testing of many people and do not have any positive test results. The private labs who have done testing have also not identified any positive lab results. We continue to test. We fully expect that in the coming days we will find cases, but at this time we do not have them. So finally, I want to thank the people of Alabama for staying tuned and trying to stay informed about this. It's a very fast-moving situation. There are changes that are occurring all the time, and our guidance is different, and many things are just almost happening too quickly to keep up with. But I want to assure you that at ADPH we will let you know as soon as we know about a case and as soon as we have any significant information that the public would want to know. So with that, I think I'll stop my comments, but I'm happy to take questions from you here.
Scott, do you have any people waiting on tests as we speak right now?
And can they hear your question, or would you like me to repeat that? The question was, are there people who are waiting on tests? There are some tests, I think, that came in later today that are still being run and are not finalized for today. But we continue to receive tests daily now that we've been testing for 1 week, I believe, and all those tests are negative. And there may be a handful today that haven't come off today. Not sure about that, but I think probably at least a couple.
How many are outstanding, if you will?
I don't know for sure. When I got an update from the lab earlier, I was told there weren't a large number today that had not been completed. I would certainly say in the single digits, but I don't know for certain. Yes.
How many people have we tested total, and what is our capacity for testing? How many tests do we have?
Sure. The actual number I'm not positive because it's difficult to keep track in the sense that one test kit doesn't equal one patient. Multiple specimens might be obtained on a single patient, and so we can use test kits, more than one test kit on a single patient. We also use some swabs for quality control, so there's not a one-to-one correlation. The number that I heard, honestly, was late yesterday. I'm not sure about today. Is something less than 50, but I don't know for sure what that number is. That doesn't count the ones who have been tested by private labs, and doesn't count the ones that were originally sent to CDC earlier before we began our own state testing. I'm sorry, could I finish?
Sure.
I'm sorry, just 1 second. And then to follow up on capacity question, we right now have plenty of capacity. We do not have any issues with handling the load that we have. We have the ability to run about 150 tests per day if we need to do that, and we have adequate material to allow us to do that. We have used the first allotment of tests we originally received. We have had requested and have already received a second allotment from CDC and are making requests for additional tests as well. So testing capacity has not been an issue for us so far. If we were to have an issue with capacity, our plan would be to try to outsource that overflow to commercial labs that would be able to handle that. I'm sorry, go ahead.
So you would not say that we have such limited resources that there must be cases out there? You're not going to make that statement, in other words, we have the one lab, I guess, in Montgomery, but isn't it likely that we're only one of 5 states in the union that has no cases right now, that there must be somebody out there with us?
Oh, yeah, I think we've been very clear about that. I expect that there are people who are infected that we have not picked up at this point. I think that's very clear. We hope, as we continue to test, to pick them up. Remember, probably 80% of people who are infected don't have serious symptoms, and so it certainly may be that a number of people have just not sought medical care if they don't seem to be that ill. But as we increase the ability to test more, we think we will pick people up. We want to make sure that we're not a barrier to people being tested, and we have discussed ways to make sure that providers can get a test if they choose to do that. We have criteria that we have put in place based on what CDC has recommended to prioritize those people who are most at risk for getting infected because they've had an exposure or they have a certain travel history. But also we want to prioritize those people who are most likely to have problems because they're elderly or because they're seriously ill already in the hospital. And we still think those are the people who are the highest priority for testing. However, if a clinician feels like they have a patient who needs to be tested, we'll essentially accept that at the word of the clinician, and we'll test that on the order of the provider.
Just on the real micro level here, somebody watching in Birmingham or Homewood or Bessemer, just the one individual who might be watching is a little scared tonight. Walk me through what that person can't. I know one size doesn't fit all, but I'm worried that maybe I have this. You don't want me going to the county health office. Where do you want me going?
Right. If someone is sitting at home tonight and wondering what they should do to get tested, the first thing I would say is don't go anywhere at all, but rather pick up the phone if that's an option for you to do so. If you have a provider relationship, if you have a family physician or a clinic that you use that you know, please call them and talk to a healthcare professional who can ask you a few simple screening questions and help determine if you need to be tested. Most people who are worried about whether they should be tested may not need to be tested, but certainly only you and your healthcare provider can make that decision. So once your healthcare provider has decided that perhaps you do need to be tested, then they will contact us and we will arrange for testing to happen. There are certainly people in our state that don't have access to a healthcare provider. Perhaps they don't have insurance or they just don't have a physician that they have an established relationship with. What we would ask you to do, again, is pick up the phone. Call an urgent care clinic, possibly, or a community health center nearby. Call an emergency department if you need to, and try to ask for information and try to make it so a determination can be made whether you need to be screened or not. If there's the advice based on what that health professional tells you that you need to be screened, that health professional can contact us and we'll arrange for testing to occur.
Question, what would you tell people who are getting ready to take off for spring break? They're making plans for trips. What advice do you have for them?
Yeah, as spring break approaches, we know a lot of people will be traveling. I would say that the first thing is just to be aware of the situation. The situation is changing very quickly, and in real time, we're seeing disease pop up in different places. At this time, the true hotspots that we know about in the U.S. are in California, they're in the Seattle area, and they're in New Rochelle, Washington, just north of New York City. Those places clearly have a high level of community transmission and ought to be avoided by travelers. With respect to other locations, we don't have concrete guidance on that, but I think all people should be prudent. We know that there are cases that have been identified in just about every state, even in Alabama where we've not identified a case. I don't think there's any doubt that we probably have disease circulating to some degree, or at least isolated cases. So I would ask people to try to think about whether their travel is essential or not, whether this is a good time for them to be doing that. Certainly people that have chronic chronic health problems or who are elderly ought to do their best to be prudent and stay away from groups of people where they might contract illness.
A little bit of good news here. What is your reaction to what seems to be happening or not happening in China, where all this began? I guess going back 3 months now. These new cases seem to be dwindling to single digits by the day. So, can we extrapolate something from that?
Yeah, I think it's hard to know. There's certainly not a direct correlation necessarily. There are a lot of factors different between what's happening in China and what's happening in other parts of the world. But clearly the disease there has been going on since certainly early December and perhaps even in November. Now we're almost in mid-March and we finally see a decline in the numbers of cases. I think that's similar to what we would expect with any type of outbreak in a way. We do see it dwindle after a few months. I would think even with cases in this country, if we have large numbers of cases, we would expect it to run a certain time course. But really it's just hard to say at this time. A lot has been said about the phrase of flattening the epidemic curve. You may have heard that. And really what that means is even if we have a large number of cases over a short period of time is much more difficult to manage than if we have exactly the same number of cases, but just spread out over a little bit longer amount of time. That allows hospitals to work within their surge capacity, for example. It allows providers not to be overwhelmed. It allows people to get information in a little bit more timely and organized way. So we want to make all the interventions we can to make sure we do flatten this curve, to make sure that if there is transmission that's occurring regularly in our state, it's happening at a pace that we can manage within the resources that we have. Yes. Yeah.
Go ahead.
No, I was going to ask, do you have any information on how many patients right now might be showing symptoms or might be waiting on tests?
I don't know the answer to that. I'm not sure. I will tell you that we have had clinicians who've called us about patients when we began testing earlier that were clearly not appropriate candidates for testing based on the criteria that we have. Now that we have liberalized those criteria, I don't believe that will be an issue. If a clinician in his or her clinical judgment feels like a patient needs to be tested, we will do that test for them.
Can you discuss what is the criteria on who gets a test and the plans for the $5 million supplemental?
Sure. In terms of who get the test, is that a question about who actually gets screened, who we're able to screen? Yeah. I think the simplest answer is if a clinician has a patient they want to be screened, then we will certainly do that. If there's an issue or a problem getting that done promptly, they also have the opportunity to send those people to commercial labs, and we think that's a terrific idea as well. We want all people who need to be screened in the minds of their practitioners to make sure that they get screened. The criteria we have really prioritize those people who are most at risk for serious illness or those people who are most at risk for actually catching the disease. So our prioritization includes people that have fever or cough or shortness of breath or similar symptoms indicating respiratory tract infection, and they have either come from a part of the world like China where there's intense local transmission going on, or they've been exposed to a known case. Perhaps they're a family member or a close contact of someone who's a known case, or similarly a healthcare worker who is caring for someone who's a known case, because those people are certainly at very high risk for having the disease, and if they have symptoms, we absolutely want to prioritize testing for those people. Additionally, we have added the criteria of people who are over 65 or people who have chronic health problems who have symptoms. If those people need to be tested, we certainly want to make sure that they get tested. Finally, if we have people who are hospitalized with similar symptoms, that is, they're sick enough to be in the hospital, and if there's no other clear explanation for what's going on, we certainly want to make sure we test those people as well. People who have serious illness without an obvious explanation, we want to make sure we test them as well. So those would be our priority groups. Those are the ones that we feel like our test is most likely to give good information that could make a difference. But again, at the same time, if providers have other patients that they would like to test, then we'll take them at their word and make sure that they're able to get tested. The second part of your question had to do with the supplemental budget appropriation that was passed today, and as I understand, was signed by the governor today. That was a budget appropriation that the legislature wanted to distribute, after talking with public health and with some other groups over the past several days. They want to make sure that while we're waiting on federal funds to come down from what the U.S. Congress passed last week, that we would have the ability to make sure we keep up with any demand for testing and demand for screening. So the plan is still being developed, but generally speaking, we will make sure that there are areas where people can be screened around the state. I don't know exactly what the number will be, but we'll have them perhaps not in every single county, but we'll have them around the state so that people have access to be tested, or to be screened rather, and have their specimens collected so that we can test them. Even if there's not a screening center that's going to be located in a particular county, we still have the ability to work with local hospitals in other counties, or with certain clinics in other counties, so that we can get people screened wherever they are should the need arise for that.
They'll be screened to see if they need a test, or can they walk in and say, I need a test?
Right. So the screening is actually collecting a specimen. So at that point, a decision would have been made that they need to be tested. And so we still think it's prudent at this time for them to go through a provider. Part of the plan involves developing a way for people without a provider to receive some type of consultation so that they can be approved for a screening if they need to have that. At this time, the plan is not to open it up to the public necessarily to walk in and ask for a test. That may become necessary at some point, depending on what we see. But at this time, we feel like those tests ought to be prioritized for someone that a physician or other provider has seen, or at least spoken with, and made a decision that they ought to be tested.
To the person or their insurance? If they
There's not a cost for any tests that are done by ADPH. Tests that go to private labs, that's depends on the policy of those labs.
But you don't think it's prudent to maybe have storefronts in Birmingham or Huntsville or Dothan at some point where people could just walk in?
We don't have plans for that at this time. Part of the issue, as you know, is there is some risk to healthcare workers who are collecting samples. There is guidance on how on what type of personal protective equipment they need to wear, for example. And so that's why most doctors' offices probably aren't the right place to get screened, and why we've tried to make arrangements for other facilities. There has been a little bit of loosening of those criteria. Just this past Tuesday evening, CDC issued some guidance that is a little more lax about the type of PPE that people have to wear if possible, and that'll possibly increase the number of sites where we can screen. But at this time, it really needs to be in a slightly more controlled environment than just an open storefront to the public.
Question about people living in counties that border states where the virus has been diagnosed or confirmed. Is there anything extra they should be doing? You feel kind of like, okay, it's not near me yet, but the folks around the borders are feeling much closer to it.
Sure, that's right. Again, I think we would recommend that people be smart and be prudent in all the ways that we talked about before. There are cases that have been identified in all of our bordering states, as you know. Again, as I've said several times, we're certain we probably do have cases in the state that just haven't been detected at this point. So whether you live immediately adjacent to a known case in another state or not, we would still encourage you to use all those hygiene behaviors we talked about, be smart and be prudent about being in groups of people where that you may become infected, and that's particularly true for people who are elderly or who have chronic health problems. Was there a question?
What about the more remote areas of the state, counties that don't have urgent care centers, people that live there that don't have doctors? Is that where some of the screening sites will be placed, or?
We're still developing exactly where they will be. I can tell you that a number of hospitals have contacted us and agreed to provide screening sites. Hopefully not in their ER. I think that the point is they would like to avoid having them in their emergency department, but we're trying to partner with them to make sure that we have sites perhaps that are in an adjacent building, or perhaps in a tent, or perhaps a county health facility can be used, but hospital personnel can work there. The hospitals have been great partners and have worked really hard to make sure that they support the mission that we have of trying to protect the public. So we have a number of hospitals that we know who are interested in participating in this. We're still trying to identify locations in parts of the states where we don't have a hospital facility to do that, but we're confident that we can do that. We want to make sure that everyone who needs to be tested can be tested regardless of where they live.
Last question, hopefully. When are you supposed to like self-quarantine? What are those guidelines? If I'm saying, oh, I don't know if I traveled by airplane or I rode in a taxi, or who do you recommend?
Sure. So the question has to do with self-quarantine. And if I could start out by saying another oft-repeated social media rumor is that we have people quarantined around the state. There are no people quarantined around the state. A quarantine would be a legal procedure that we would go to a judge to enact, and that has not happened. Sometimes the word just gets misused, and frankly, sometimes probably misused by us. But we do have people who self-quarantine. Most of the people who have been self-quarantined are people that we advise to stay home for 14 days because they are at a higher risk than the average person for infection. So, for example, in Alabama, most of those are people who have returned from China in the past 3 months. All the travelers from China, but now also travelers from places like Iran or South Korea or Italy are also people that we ask to stay home for 14 days. We ask them to monitor their symptoms and to get in touch with us if they have any issues. In many cases, these are students, and so we're working through their employee health units within colleges and universities to assist with monitoring them. Some of them are employees. We continue to have people who travel to China, for example, as air crew or people who are still working, and so we work through their employee health units to make sure that those people are adequately monitored and adequately self-isolating. So the best term would really be social distancing and self-isolating. Sometimes I think we do say self-quarantine and don't mean to be confusing about that word. But a self-quarantine would be advised for those people who are at highest risk for infection. Yes.
How many of these screening centers are we looking at establishing with the 5 million?
I would say, first of all, the 5 million applies to a lot more than only the screening centers. Besides screening centers, there are other elements of that plan that are still being worked out. But the initial numbers are probably somewhere in the neighborhood of 20 to 25. But that's still a very fluid plan, and we don't know for certain.
What determines whether somebody is tested by a private lab or the state health lab?
It's the person's provider makes that decision. So when a provider sees a patient and wants to have the patient tested, then he or she can decide either to send that specimen to public health or they can send it to a private lab.
Are the private labs required to report to the health department the results?
Yes, they are. There are certain notifiable diseases that all providers and labs are required to report. So certain types of things like, for example, one everyone would be familiar with would be Ebola. You know, if there were a case of Ebola somewhere in the United States, the hospital or the lab who made that diagnosis would be required to report that to public health. And in fact, there's a whole list of diseases that are urgent and that have public health significance that labs are required to notify us about. COVID-19 disease was actually added to that list last week through an emergency rule. In order to amend our rules and change those reportable diseases, we have to go through the whole administrative rules process, and it goes through public comment, and it takes about 3 or 4 months. And so in order to start getting that information immediately, there was an emergency rule issued through our State Board of Health, which is valid for 120 days. And it says that labs or providers or anyone who diagnoses a patient with COVID-19 disease has to notify the health department within a 4-hour time period.
Scott, at this point, based on what you know, at what point do you think Alabama will be out of the woods, that we're in the clear? Are we talking 1 month from now, 2 months, or what's the time frame?
Yeah, I think I wish I knew the answer, but I think it's unclear right now because this is such a new disease. Certainly, you might get some sense of what happened by looking at China, and it's taken them 3 or 4 months to sort of see that epidemic abating there. We really don't know what it will be like here. I would say a typical respiratory tract infection, like a flu season that we have every year, can last a few months, and so I would say a few months is a reasonable expectation.
If we have plenty of testing capacity, why have there only been 50 people tested in the state lab? Is it the prioritizing of, and why are we prioritizing if we have good capacity?
Yeah, I think we have prioritized those people that we think are most at risk. With the group of people that we mentioned, people who have symptoms but also have had exposure to a known case, or who have traveled to an area with transmission, or who are seriously ill in the hospital and have no other explanation, that's actually been a fairly small group overall. Now, what I don't have at this time, or don't remember at the moment, are the number of tests that have gone through private labs, but there's some number that have gone through private labs as well. But our plan is to make sure that anyone can be tested that actually needs to be tested. And so we have liberalized those criteria so that if a provider makes a decision to test someone, we will do that for them.
Have you issued any specific guidance to nursing homes or senior living facilities who seem to be very much at risk?
Yes, absolutely. There is very specific guidance for nursing homes and assisted living facilities and specialty care assisted living facilities. We have spoken with them many times. We just had a call with many of them. I believe it was yesterday. We've talked to them several times. Those seniors who reside in those facilities are at particular risk, and so we want to make sure that they are protected, particularly in view of what we saw in King County, Washington. So those institutions have great plans for dealing with outbreaks. In fact, congregate residential settings are places that do have outbreaks from time to time, and typically they're foodborne, but many times they can be respiratory tract, like influenza. It's not unusual to see respiratory outbreaks in flu season. So our nursing homes and assisted living facilities are actually really good at managing that, and so we feel like they have good plans in place. We've asked them to make sure their staff is again primed and ready to deal with that, to recognize when someone is ill and to make sure they get medical attention, and a decision could be made about, for example, does someone need to be tested or not. We want to make sure they have personal protective equipment, and that's not something that they always have as much of as they would like, but we think that they're adequately stocked at this time. I know many nursing homes now are being a little more careful about visitation. They're monitoring visitors when they come in. They're putting up signage saying, if you're sick, please stay away. If you have a fever or cough, come back a different day. And so we think those are very prudent. We encourage them to continue to do that.
Can you describe a little bit about when your webcasts will be happening and how people can interact with those webcasts?
I will get you that information as soon as we're done. I don't have it in front of me, but we'll do it at 10 a.m. tomorrow. I believe it'll be done from this room. And the idea was to reach out to a lot of people who don't necessarily have access to ask questions. So obviously the press is welcome to come. It's not designed exactly for the press, but certainly it's open to anybody who would like to participate.
So for people like me with short attention spans in television, bullet points from what we've just covered in the last half hour. The supposition is, as of this hour, there is no case. You are calling on people who are in groups of greater than 500, perhaps outside of a school or business setting, to suspend. 6 feet away, if you can do that, and I guess more testing sites on the way. Have I covered most of what?
That's exactly right. You did that much faster than me. Perfect.
I'm the son of a doctor, so I've always had to ask him to.
How quick is the turnaround on a test? If somebody is tested today, will they know within 24 hours or much sooner?
Yeah. So what we have said is 24 to 72 hours. Most of them are quicker than 72 hours. Some of it depends on what time of day it comes in, but we are testing 7 days a week, and so we have the ability to turn it around fairly quickly, depending on what time of day it arrives and how many tests we're doing that day.
And what do you say to those who feel that this is overblown? A lot of fear factor, much ado about nothing. These are not my words. I'm hearing that myself. So.
Sure. I think we always are very careful to try to thread the needle between having people be prepared and having people be careful and take proper precautions, and then being alarmist, because we certainly don't want to do that as well. The message that I hope people recognize is that this is really a serious disease. It's affected 130,000, I think is the last number I saw, people around the world. For people who are older or who have chronic health problems, this is a legitimately deadly disease. The death rate from this disease, even if 1 or 2% sounds low, is still 10 to 20 times the death rate from influenza. And so we think people need to pay attention, to be prepared. We think most Alabamians are not at risk for serious illness. We think children are not generally at risk for serious illness, but everyone needs to be prepared. All right. Is there anything else?
Thank you very
Okay.
much, sir.
Thank you very much. Thank you for joining us today.